Hi, my name is Mackenzie Coughlin, and today I'm going to talk to you about using contact lenses to treat ocular diseases. So as a brief overview, I'm going to talk about the traditional methods for delivery, the recent advances that have been made, and then the advantages to using contact lenses. So my objectives today are to discuss the ocular diseases and the conventional method of treating them, to discuss the recent advances that have been made in drug delivery methods, and then to discuss the advantages of using contact lenses as the main drug delivery method. So as a little bit of a background, there are many different types of ocular diseases, and some of these can be really difficult to treat based off of what tissues they affect. So you might have some that affect the tissues real close to the outer side of the eye, but you might also have some that affect really deeper tissues, and these deeper tissues are very inaccessible to the traditional methods of drug delivery. The eye also has many barriers that can prevent the delivery of the drug, so whether it's the body's natural responses like blinking and tear production, or whether it's the many membranes that the drug might have to go through. These different things can cause the amount of drug to be delivered to the eye to actually be a very small amount. So the successful treatment of these diseases actually needs a longer period of time where the drug is in contact with your eye tissues. But this can be difficult depending on the toxicity, because if you have a high concentration of drug in contact with your tissues, you can actually be toxic to the body. So traditionally or conventionally, eye drops have been the method of treatment. Just you have the drug in a solution, and the drug has to be applied through drops in the eye. But because they have a low concentration, they have to be frequently administered to keep a continuous supply of the drug. So some disadvantages of eye drops: like I said, the dose is pretty small, so this helps prevent the toxicity, but you have to continuously administer them. And this can be problematic if you have somebody who has trouble with applying eye drops to the eye. So this small dosage also automatically decreases the amount of drug that is available through the contact lens. Then you also have tears, and tears are produced by the eye automatically, so they will go into the drug solution and dilute it. And so then you have less concentration of the drug that has to go through all the tissues. And your eye has the drainage systems, which can also drain the drug away from the eye. Also, you have the many membranes that the eye drops have to go through, so sometimes, because the eye drop has to spread over your entire eye and then go through all these membranes, some parts of the drug is actually absorbed by the other membranes. So not the ones you're targeting, but you can have drugs affecting different tissues that you don't want them to be. So because this small dosage is delivered to the eye from these eye drops, they have to be administered very many times. So that's why you get eye drops and you get multiple bottles, and you have to do it every few hours or multiple times a day or however long you need to be able to treat these diseases. Eye drops also have a limited shelf life, so preservatives have to be added so they can last for a longer period of time. And these preservatives can also affect the toxicity of the drops. So these are some of the eye's natural barriers. So like I said before, first you have your eyelids. So your eyelids with your blinking, and as soon as you put the eye drops in your eyes, you start to blink because your body doesn't want things in your eyes. So immediately a huge amount of that drug is washed away and spilled over onto the cheeks. You also have your tear duct, so your tears are being produced, they dilute the drug again, and then your tear duct is connected to all of the drainage systems, so the drainage through your nose and through the back of your, behind your eyes, and that can further make sure there's less drug available to be able to get to the tissues you want it to be in. So once these outer barriers are gone through, then the drug has to penetrate through all of the layers of the eye. So let's say you have glaucoma. Well, glaucoma affects the choroid tissues, which means that you apply the drops out here and they have to go through your cornea and all of these tissues, your sclera, your aqueous humor, your vitreous humor sometimes, just to reach these choroid tissues at the back of the eye. So recent advances in treating ocular diseases have focused more on increasing the amount of contact time. So increasing the amount of time between the drug is going to be in contact with the specific eye tissues that you want it to be in. Some examples of these are in situ forming gels, ocular inserts, and contact lenses. So in situ forming gels are liquids that become gels once they enter the eye, and that's because of the temperature difference between the surrounding air and your eye. And so these gels have a higher viscosity than like eye drops would. And so this increased viscosity means that it's going to sit on your eye and not go anywhere. So it can't be washed away, it can't be blinked away, or anything like that. But this also increases the contact time. So it's just sitting there, it's not going to go anywhere. You have more time for the drug to be released. This application is convenient for patients because it starts as a liquid. So it can be applied like eye drops would be, but it would stay there and immediately become a gel as soon as it goes into your eye. The main problem with these is that the increased viscosity of the gel, it sits on your eye, and so you have to keep blinking because it irritates your eye, so you continuously blink. It can also blur your vision because a lot of the times they're not completely clear. It is a gel, so it does have some opaqueness to it. And then you can get a sticky sensation because of the viscosity. So ocular inserts. So these are solid objects that are placed in the precorneal region of the eye. So that just means a lot of times the doctors will place it in the corner of your eye underneath your eyelid. And so these, depending on the material that it's made of, can have a controlled, sustained, and continuous release of the drug. So the membranes allow for the drug to be released over a longer period of time and a specific amount at the thing. So you only have to put in the insert once, and then you don't have to worry about multiple applications. Some of the inserts can be degradable, which means that after a period of time when there's no drug left, it'll just degrade in your body. You don't have to remove them. But you also have ones that are non-degradable, and so those you would have to go back in for surgery or whatever, go back to the doctor to get them removed. The main problem with these is a lot of people do not like having solid things in their eyes. Even if you don't feel it, just the idea would be resistant. But depending on the material, you might actually be able to feel it, which could definitely cause irritation. Okay, so the structure of ocular inserts. So you have these membranes on the outside, and that is what controls the release of the drug. You have the reservoir, which is where the drug is actually at, and you have this annular ring that surrounds the reservoir, and it makes it so you can see, or the doctors can see the insert, so they can actually put it in your eye and not like fall and drop on the table, and you don't know where it is anymore. So contact lenses. So contact lenses are plastic discs that cover your cornea. So they sit on your eye, and they adhere to it using the tension in your tears, so the surface tension. And a lot of these lenses, depending on the material, are hydrophilic, so they absorb any water-soluble drugs. A lot of during research or in production, you take these contact lenses and you put them in the drug bath, and you leave it over a period of time so the drug can be absorbed into the lens. And the different materials that you use will change the amount of drug that can be absorbed or released. So you have to have a specific material of the lens to be able to use the specific drugs. And the release of these drugs is based off of the materials. So depending on the material that you have, you can release more drug over a longer period of time, or you can release a little bit at this time and then wait a little bit, or you release a whole bunch at the beginning and it slows down. Just depends on that, as well as whatever coating you have around the drug. So some of the research being done now is coating drugs in nanoparticles, so that way more of the drug can be absorbed into the lens and then released and only affect these specific tissues that you want it. So some of the advantages to contact lenses is you have the increased contact time between the drug and the eye. That's because it sits on the eye, it's there all the time. And you can have a prolonged and controlled release of the drug. So like I said before, the different materials allow you to release more and over a longer period of time. Actually, research is being done using temperatures, so the different temperatures of surrounding the contact lens change the amount of release time. And I think some professors here at UF actually are working on making that release time to be up to 2 weeks. So you put the contact in, and then once it's in, you get the same drug continuously for 2 to 4 weeks. You can also have tissue targeted delivery, so no drug will be delivered, or very small amount of drug at least will be delivered to tissues you don't want it in. And because contacts were originally designed for vision, so to help you see better, they don't interfere with your vision. And actually, research is currently being done to make those prescription lenses be also used for drug delivery. So, in conclusion, eye drops are the traditional method of delivery, but they have a lot of disadvantages to those. Recent advances, including in situ gels, optical inserts, and contact lenses, have focused more on increasing the contact time between the drug and the eye tissues. And contact lenses are the current research is being done on, and they have many advantages to using them for treatment. And right now, researchers have been looking towards enhancing these even further. And then these are the sources that I used. Do you have any questions? All right, thank you. I took my